Good day everyone! So welcome to our scenario entitled Doctor in Crisis. So this short dramatization presents a difficult moral dilemma that nurses may encounter in a real hospital setting. So I am Princess Ruiz, playing the role of Nurse Maria, your narrator, and one of the participants in this scenario. So now, let me introduce you to the other characters. Nurse Carla, played by Cataag, the senior nurse, responsible and diplomatic. Miss Santos, played by Rica Diaz, the hospital administrator, calm and authoritative. Dr. Reyes, played by Cedric Aquintey, a male surgeon who appears agitated and is suspected of drug use. Nurse Anna, played by Jema Lalio, a staff nurse who is observant and concerned. In this situation, a staff nurse observes that a well-respected surgeon, Dr. Reyes, is displaying signs of erratic behavior such as tremors, slurred speech,
The tremor is an involuntary, somewhat rhythmic muscle contraction.
and confusion. Just before a scheduled operation, the concern arises that he may be under the influence of drugs. What follows is a series of decisions rooted in ethics. Now, should the nurses report their suspicions and risk delaying the surgery and creating professional conflict? Or stay silent and proceed with the operation, potentially putting the patient at risk? So now let's begin.
Rhea, can I talk to you? I'm really worried. I saw Dr. Reyes a few minutes ago. He's not himself. His hands were shaking. His words were slurred and he looked unsteady. He almost fell near the locker room.
I saw it too. He was shouting at an intern during an endorsement. I've never seen him like that. And he's scheduled to operate on that elderly patient with a triple bypass in less than an hour. We can't ignore this, but what if we're wrong?
Mom, Carla, I need to report something. We believe Dr. Reyes may not be in the right state to perform surgery today, as his behavior is really unusual. He looked disoriented and unstable.
This is a serious accusation. Are you both absolutely certain about what you saw?
Yes, ma'am. He wasn't acting normal. I'm worried about the patient.
I understand it's our responsibility to keep patients safe, but we also have to follow procedure. And we are talking about a senior surgeon. If we escalate this, it could delay the operation and cause a lot of tension. Still, we can't ignore this. I'll take it to the hospital administrator. Miss Santos, I need to raise a concern. Our surgical team noticed that Dr. Reyes may be impaired today. His behavior has been erratic. Slurred speech, tremors, agitation. He is scheduled for surgery soon. and we are worried about the risk to the patient.
You did the right thing by informing me. This is a delicate but urgent matter. I will speak to Dr. Reyes directly. In the meantime, document everything clearly. The time, what was observed, and by whom. We must be fair but also protect the patient. We'll take it from here. Dr. Reyes, I need to speak with you. Concerns were raised about your condition today. For the safety of your patient, we will need to postpone the operation and conduct a formal assessment.
What? That is absurd. I'm fine. What kind of accusation is this? I've been under more pressure than this. This is ridiculous.
Doctor, I understand that this is upsetting, but multiple staff members reported signs that you may be unwell. This is not a punishment. It's about ensuring the highest level of care for the patient.
I can't believe this. I've worked in this hospital for years. I save lives every day. And now this? Based on a gossip? You'll regret this.
I feel torn. I've looked up to Dr. Reyes for so long, and reporting him feels like betrayal, but what if we hadn't said anything and something happened to the patient?
You did the right thing, Maria. We did. As nurses, our first duty is to the patient, not to the title someone holds, but to safety and care, am I right? That surgery could have ended terribly if something was wrong with him.
I know this was not easy. Speaking up never is. But remember, we followed ethical guidelines. Beneficence, non-maleficence, integrity. These principles guided our actions. Sometimes what's right is not easy, but it's still right.
In this roleplay, we were faced with a difficult ethical dilemma whether to report a surgeon who appeared to be under the influence just before a surgery. On one side, we had non-maleficence, which means to do no harm, especially to the vulnerable patient. On the other hand, professional loyalty, respect for the surgeon's authority, and the risk of damaging his career if we were wrong. We also considered beneficence, acting in the best interests of the patient, and truth-telling and integrity, which are essential in nursing. So the decision was to report the behavior and delay the surgery. It was uncomfortable and it strained relationships, but it protected the patient. This scenario reminds us that in healthcare, there are moments when we must choose between two rights, and when we do, our guiding compass should always be the dignity, well-being, and safety of our patients.
Thank you for watching, and we hope you've learned something from us. And we're reminded of the importance of always putting our patient first. Until next time, stay ethical and keep learning.